The last module for the reproductive system will focus on pregnancy, fetal development, and genetics. Just to get you in the mood, this section is always fun to do. The objectives of this module are to describe fetal development, identify the role of hormones involved during pregnancy, describe the birth process, discuss infertility and contraception, explain the basics of genetics and inheritance. Remember from the last module that fertilization occurs in the uterine tubes, or fallopian tubes. The sperm induces the second step of meiosis in the secondary oocyte once the head has penetrated the surface of the oocyte. Like an eggshell, the zona pellucida is around the secondary oocyte, and enzymes in the acrosome help break it down so the sperm head, which contains only DNA, can enter. Once the sperm is entered, a chemical reaction takes place so no other sperm can enter, preventing trisomy, which happens rarely when you get an XXX or an XXY individual. The fertilized egg is called a zygote. It will continue to travel down the uterine tube toward the uterus. You need a whole bunch of sperm because the enzymes in the acrosome of one sperm generally aren't enough to get through the zona pellucida. So lots of sperm are helping to break down that shell of the egg, but only one should actually enter. Just some images of the egg, and then the egg covered with sperm. Perhaps you've seen this most commonly in the movie Look Who's Talking. The zygote is the sperm and the egg, and it happens on day 1. Then, after about 24 or maybe even a few more hours, it will start to do mitosis. Cleavage is basically from 2 to 4 to 8 cells, and by day 3 the future baby is then called a morula. About 96 hours after fertilization, the morula, a collection of around 30 cells, is created at that 96-hour mark. Because the cells arise only through cleavage of the zygote and are all found inside the pellucida zone, which cannot expand, the physical size hasn't gotten any bigger than the original egg. Every new cell is about half as large as the cell at which it came from. The name of the stage comes from the resemblance to a mulberry, since it really looks like a collection of spherical cells. On day 4 it reaches the uterus or so, and it is a hollow ball of cells called a blastocyst. The blastocyst can attain some glycogen-rich secretions from the uterus, and it enlarges rapidly. It will attach on day 6 to 7, which is called implantation if all is well. So here's a good egg from a 32-year-old woman. And you can see the 2-cell stage and then a morula stage. So in summary, fertilization occurs in the uterine tube. Mitosis starts 24 hours or so later. Cleavage occurs. The cells divide, but the entire thing doesn't get any bigger again because the cytoplasm is all the zygote has available. And it's called a morula around day 3 or 4. A couple days later, it's a hollow ball of cells called a blastocyst, and implantation must occur for anything more to happen. This is where it attaches to the uterine wall. Failure of implantation is very common, and it must be done very correctly or very well in order for future viability of the fetus, because this is what attaches it and is going to allow for the nourishment of the fetus. Again, another picture. Fertilization called a zygote, morula, and blastocyst. The blastocyst, again, is implanting around day 6 and 7, those 24 hours of development. The inner cell mass of the blastocyst, you can see that right here, is what's going to become the future baby. The outer cells are called the trophoblast, and that's going to become the placenta. The trophoblast secretes HCG once implantation has occurred, and this is what is detected in a pregnancy test. Its function is to go to the corpus luteum and say, hey, implantation has occurred, please keep secreting progesterone. Progesterone, remember, maintains the lining and maintains the pregnancy. If implantation fails, the trophoblast does not secrete HCG or not enough, and the corpus luteum degenerates, progesterone goes away, the lining is lost. Here's a picture of a high-quality expanded human blastocyst about 5 days after fertilization. The inner cell mass is going to become the baby. That's this at the top here, and the trophoblast is the outside cells. Here's another picture of a high-quality blastocyst. This is what is implanted during in vitro fertilization. Development of the 3 germ layers and the extra embryonic membranes occurs during a process called gastrulation, which occurs once implantation has happened. Gastrulation basically starts with stem cells to generate the different organ systems, and this is where they get stem cells from, a blastocyst that starts to do gastrulation. The 3 main layers are the ectoderm, the mesoderm, and the endoderm. The ectoderm is the outer germ layer, and it will become the skin and the nervous system. The mesoderm is the middle germ layer, and it will give rise to muscles, connective tissue like fat and bone, as well as parts of the circulatory system and kidneys. The endoderm is the inner layer, and it will become the gut organs, the digestive system, for example, and the respiratory tract. The trophoblast becomes eventually the placenta. The placenta is like a filter, and it allows nutrients and oxygens from mom's blood to get into the baby's blood, and the waste to go the opposite direction. It is protection because it allows antibodies to cross into the embryo, but it protects from most diseases. Unfortunately, some drugs, alcohol, and some infection agents like AIDS, measles, rubella, and syphilis can get across the placenta. It produces hormones, which are listed on the next slide and are going to play a role both in maintaining pregnancy but also in getting mom's body ready for birth. Some of these hormones include human chorionic gonadotropin, which again is what triggers a pregnancy test. Progesterone and estrogen eventually will be made by the placenta and not the corpus luteum anymore. Lactogen, which helps mammary gland development. Parathyroid hormone increases to increase blood calcium, which can lead to the side effect of Charlie horses for mom. Relaxin, which softens the cervix and gets ready for that stretching to occur during birth. And corticotropin releasing hormone, which increases blood sugar and blood pressure, unfortunately, sometimes as well. The next stage of development from week 2 to week 8 is embryonic development. The embryo increases in length from about 1.5 millimeters to 23 millimeters, so talking 2 centimeters, about an inch long. All the organ systems develop, and it begins to show human form. During this period, the embryo is particularly sensitive to viral infections, and so you want to try to avoid that, as well as alcohol, tobacco smoke, and lack of oxygen. By the end of the 8th week, so on the 56th day, literally it looks like a miniature baby, but it's only very small, like 1.5 inches or so. Another image of embryonic development is from the Carnegie Stage website. You can check this out. They have a picture of every single day of development. During the 8th week, remarkable development occurs. Nerve cells in the brain are forming at a rate of 100,000 per minute. The top of the head becomes more rounded and erect. Between day 52 and 56, the fan-shaped toes go from being webbed to separated. The fingers are entirely distinct. Eyelids close over the eyes and become fused shut until about the 26th week. The external genital organs begin to show differences. All the appearances of a tail are gone, and by day 56 the embryo is roughly 1 to 1.25 inches long. There's a great little slideshow of development. I'll show it in class if you want to stop and look at it right here now. Take some time to do that. The last stage of development is from the 9th week to the end of the pregnancy and is called the fetal stage. The embryo is considered a fetus at 10 weeks, and during this stage structures that have already formed pretty much just grow. Mostly what happens during fetal stage is growth. For example, by the 12th week of pregnancy, the fetus fills the entire uterus. At 14 weeks, you can identify sex. 16 to 20 weeks, usually the pregnant woman can feel the baby moving. Sometimes you can feel that earlier. The fetus has a chance of survival outside the uterus by week 24. The lungs will continue to mature until the time of delivery, as does the brain. In fact, the brain doesn't finish development until after the first year of life. As the placenta develops, it extends tiny hair-like projections into the wall of the uterus. These branch and rebranch to form a complicated tree-like arrangement to increase the surface area of connection between uterus and placenta, so you can exchange more nutrients and more waste can be exchanged as well out of the baby. The placenta is fully formed by 18 to 20 weeks, but continues to grow, and at delivery it will weigh, all by itself, about a pound. This slide just summarizes some of the things that we have talked about so far. Zygote, day 1, and then cleavage occurs to form the morula. The morula is that little ball of cells. The blastocyst then is the hollow ball of cells that implants into the wall of the uterus. The trophoblast is eventually going to form the placenta. It undergoes gastrulation. The 3 germ layers form different organ systems. It is in the embryo stage from week 2 through week 8, and then in fetal stage, or the fetus, from that point on. Getting pregnant can sometimes be difficult. Some things that aid or increase the likelihood of pregnancy are listed here. First of all, sperm must be motile and numerous. They must be able to swim, and you need a lot of them. It increases the odds of pregnancy. Sperm can live up to about 3 days in the female reproductive tract, but the secondary oocyte only has about 24 hours. So having a viable oocyte when viable sperm are around is also required. Peristalsis helps move sperm up. If the woman has an orgasm, this increases. Estrogen increases the serous-like secretions of the vagina, making it easier for sperm to swim. Other times, the secretions are more mucousy, and that impedes sperm. Remember, sperm don't move in a straight line. Of the 500 million that are put there, only a couple hundred ever get to where the secondary oocyte is. And if progesterone levels are high, that is even less because the sperm get caught. These things give a window about 4 days at the longest when a woman is considered fertile. Being pregnant is physically quite a lot of work for the woman's body. The average weight gain is 13 to 15 pounds, but can be a lot more. And because of the size of the babies, the organs get pushed out of the way because the uterus is so large. This can make it difficult for X-ray technicians and doctors to diagnose problems because things aren't in the location they normally would be in. The lungs expand and breathing rate increases, as does tidal volume. Carbon dioxide levels increase in the blood, which causes increased breathing rate as well, but it also increases renin and erythropoietin, so the woman will make more red blood cells. This indirectly increases aldosterone, which increases water retention. Blood volume goes up 50%, and that, of course, is going to increase blood pressure. Up to 30% more food is required to maintain the life of a baby, so the woman has to eat more, and yet her stomach is being pushed up by the uterus, making it feel fuller but also more likely to have heartburn. Your kidneys must filter more waste. Glomerular filtration rate increases up to 50%, but the bladder can't hold as much, so urination is more frequent. Of course, mammary gland development is also occurring during this time. The definition of labor is the time of giving birth, also known as parturition. It is not completely understood what initiates labor. Several hormones seem to be involved, made by both the woman, the placenta, and perhaps even the fetus. For example, estrogen production greatly increases, which increases sensitivity of the uterine myometrium, the muscle, to oxytocin. Estrogen also helps loosen the pubic symphysis, as does relaxin. Oxytocin may increase as the uterine wall stretches, and that a positive feedback system, more oxytocin, you get more stretching and therefore and eventually contraction. Relaxin, made by the placenta, also dilates the cervix. The weight and size of the fetus stretches the mitometrium itself, and it's known that the female pituitary can secrete oxytocin, so perhaps all of these contribute to contraction of the uterus, and once it starts, again, it's a positive feedback system. The baby's going to be born. The steps of a normal birth pattern are shown on the next slide, so I'm going to go to that one and then I'll come back to talk about placenta removal and involution. So progesterone decreases, and stretching of the uterine tissue stimulates the release of oxytocin, which stimulates more uterine contractions. More and more oxytocin is released, and each contraction gets stronger. The fetal head stretches the uterus, and this induces more release of oxytocin. As birth approaches, progesterone levels decrease, and prostaglandins may also initiate labor. Fetal head stretches the uterus, but it also pounds against, literally, the cervix, which eventually will dilate that. The first and the longest stage, or the initial stage, lasts an average of 14 hours in the first birth, but less for later. And it involves violent contractions so that the baby's head dilates the cervix. The second stage, or expulsion, may last from a few minutes to 2 hours, and in this stage the contractions slow a little and the baby begins its journey to the outside. Notice the head is facing down, and then as it comes out, the head turns slightly to the right to allow the shoulders to come out. And then the last stage, the placenta needs to be removed or taken out. This takes another 10 to 45 minutes, and you need to make sure it's completely out because it's a high risk of infection if the placenta stays in there. Alright, so we're going to go back to that other slide and talk about placenta removal and involution. Again, failure to make sure the placenta is all removed increases your risk of sepsis for the mother. It was the #1 cause of maternal death. They called it childbed fever. Basically, they got an infection and died from it because the placenta wasn't properly removed. The uterus must also shrink back to normal size, a process called involution, so that the muscles don't get too stretched out, which could impede carrying a second or third baby, for example. Usually a nurse or a healthcare professional will knead or press on the woman's lower abdomen the next day to help this process, which apparently is quite painful. Oxytocin will also help do this, and so when you nurse, which is when oxytocin is released from milk letdown, will also cause the uterus to contract back into shape. So that's another benefit of nursing, is helping the involution process. Again, the milk letdown reflex is stimulated by nervous system stimulation, either physically or even hearing or seeing the baby sometimes. Oxytocin is released from the posterior pituitary. It causes the milk ducts to open, and milk is ejected or released from the breast. Because the prolactin receptor has been inhibited by the high progesterone, the first time you nurse, the first couple of times, it's not actually milk because there's no milk proteins in it. It's called colostrum. This contains antibodies which boost immune protection in the baby, and so they sometimes want you to nurse that first time or first couple of times, even if you don't plan on continuing, because it is such a good thing for the baby. During development in utero, the baby doesn't need to send very much blood to the lungs. It's not going there to pick up oxygen because the baby's not breathing at this point oxygen. There's amniotic fluid. The oxygen is obtained from mom's blood. Anyway, because the lungs don't need a whole lot of blood, there is a hole between the right and left atrium to skip the pulmonary circuit. This hole is called the foramen ovale, and when the baby is born, when they take their first breath, the hole closes, which I think is kind of cool how that works. Sometimes it doesn't close completely, and the baby must have surgery to fix it. Maybe you've heard of a baby was born with a hole in its heart. Technically, we all have a hole in our heart. It just doesn't always close 100% of the time. Alright, the last few slides are some information about different stages of life and genetics. Your life is divided into 5 stages of development. Neonatal is referred 2 as the time between birth and about 1 month of age. And you're at most risk for infections at this time, and you have to be really careful with the baby because their immune system and all the other organ systems are kind of getting used to this whole being outside mom thing. Infancy is until 1 month until about age 2. Generally it was described as the time where a child might be still nursing. Childhood is from that time until age 2 or so, until adolescence, and then puberty, or starting the hormones being released at puberty, indicates the next phase called adolescence. Maturity is considered started once growth has stopped, and this can be anywhere between 18 and 25 years of age. Some websites, or where they're talking about life stages, then move on to elderly or aged as another stage when basically repair doesn't keep up with when cells die. They don't get repaired or replaced as fast as they're dying. It is estimated that 1 in 6 couples face difficulties in conceiving. If you have unprotected regular sex for more than 12 months and you're not over 35 and you're still not pregnant, you should start thinking about possible causes of infertility. And there's many different causes, and some are just unknown. About 35% of infertility causes are found as a problem in the female, another 35% in the males, and the last 20 or 30%, there's either problems in both couples or it's just literally 10% of the time they have no idea. Unexplained infertility. Okay, some of the different methods of contraception, and you can click on this website and it talks about how effective they are. The first one, coitus interruptus, is Latin for the withdrawal method. The idea is the man will pull out before he ejaculates to reduce the amount of sperm. This is not a very effective method of contraception, and it does not protect you at all against sexually transmitted diseases. But it's free. The rhythm method is basically avoiding sex around the time of ovulation. It too has a pretty high failure rate because it's hard to tell exactly when the woman is ovulating. And of course you have to know when you ovulate in order to avoid having sexual intercourse during that time. The only one on this list that is protecting against sexually transmitted diseases is the use of condoms, particularly with the use of a spermicide as well. There are both male and female condoms available, although male condoms are more common. They do have lambskin condoms if you're allergic to latex, but they do not protect against sexually transmitted infections because they are somewhat porous. The diaphragm or cervical cap is placed up inside the female to prevent sperm travel. It can be used with a spermicide as well. It must be left in for 6 to 8 hours after sex to prevent a pregnancy. So compared to the condom, you don't have to stop and put it in right at that time. It can be put in ahead of time. Whereas a condom, one of the disadvantages, not only do they cost money, but you have to stop and put it on at a time where you don't necessarily want to. The next thing on the list are various hormone methods. They work by preventing ovulation. They can be estrogen, progesterone, or a mix of the two. There are shots, patches, implants. There are pills. There are transdermal gels. There are vaginal rings. There's a bunch of different types of hormones, and long-term use of hormones should be discussed with your doctor to determine whether that's a high risk for you, depending on your risk factors for various female cancers. The morning after pill is actually a large dose of hormones, and it prevents implantation. IUDs, or intrauterine devices, were used for a long time, but had some bad reputation because of the heavy periods. They're basically put up in the uterus, and there's a picture here, and it was thought that the copper in them prevented implantation. New ones, there's a 5 and a 10-year model, are laced with some progesterone to help prevent some of the heavy periods or painful periods that were associated with previous IUDs. An IUD can remain and be functionally effective for many years. However, the two little fish line-like things hanging down are used for a doctor to remove it. However, increases slightly your chance of sexually transmitted diseases because now the bugs have a way to go up through the cervix and into the uterus. So they're generally recommended for women who have just one partner and want to prevent a pregnancy rather than somebody who might be more promiscuous. Surgery and sterilization techniques, vasectomies, tubal ligations, is a more permanent option, as generally these are not reversible, although sometimes they are and sometimes they heal. In either case, tubal ligation cuts the uterine tubes and a vasectomy cuts the vas deferens or ductus deferens. They cut, cauterize, block. There's a bunch of different techniques, but the idea is to prevent sperm travel. Okay, a little bit about genetics before we finish up this section. Every gene, and you have between 20 and 30,000 genes, 25,000, codes for just one or two proteins. And the collection of proteins that you make gives you your traits. It's what determines the shape of your cheekbones, it's what determines whether you're right-handed or left-handed, what color your eyes are, etc. Often you have more than one copy of each gene. You have an allele from mom and an allele from dad, and the combination of those two determines what you look like. For example, sometimes your genotype, your alleles, is not known because you would have to do genetic testing to know what exact alleles you have. But the phenotype is what the alleles make you look like. So for example, if you have a widow's peak, that is dominant to have one, I believe, or the ability to roll your tongue is dominant. So if you got the dominant allele, if you got the tongue rolling allele from dad, then you can roll your tongue. It doesn't matter what you got from mom. Maybe both of them are the same, and so you can roll your tongue. If you didn't get either, you didn't get a dominant allele from mom or dad, you can't roll your tongue, and your genotype is recessive for both. So in that case, you would know. But if you can roll your tongue, you don't know necessarily whether the allele from mom and dad are both dominant or just from one of them. So your genotype tells you what your alleles are, and your phenotype tells you what you look like based on your genotype. Not all alleles is one dominant and one recessive. Sometimes they're co-dominant. For example, in plants, red roses and white roses, if you cross them, sometimes you get pink roses. So both alleles are producing the pigment and they kind of mix. The next page here has a list of single gene traits in humans. So baldness, for example, is determined by one gene. If you have the gene for baldness, that's dominant. So even if you had one for bald and one for not bald, you're going to be bald. One of them down there is dimples. Dimples are dominant. If you have the gene for dimples, you have dimples. If you have both copies, you still have dimples. Widow's peak, it's dominant to have one. RH factors in the blood. If you have the Rh factor, you have positive blood. Anyway, you can look at the different genes on there. And in the previous slide, you could see widow's peak, no widow's peak, or hitchhiker's thumb, the bent thumb, that's dominant. No hitchhiker's thumb is recessive. Okay, so most genes are controlled by several traits, like intelligence. There's no one gene that makes you smart or makes you dumb. There's different kinds of intelligences, and there's different genes involved with that. And maybe someday they will know them all, and they could analyze that, but it can be influenced by environmental factors as well. So why do we care about genes? Well, could we fix some that are goofed up? For example, sickle cell anemia is a mutation in the hemoglobin gene. Could we fix that in people? And gene therapy is using the genetic information to try to figure out what's wrong and then insert a normal gene into a cell that is mutated and fix the problem. So one of the ways they're doing this is by infecting you with a virus that has the bad genes have been taken out and the good normal gene has been put in, and the virus goes into the cell and puts that gene back into your genome. They're using this to actually treat cystic fibrosis, hoping that they could use this to fix other genetic diseases. Finally, don't forget your online lesson, your online book, some good websites, and you can always ask me.